Audible Incorporated presents The Baptist Healthcare Journey to Excellence, written by Al Stubblefield, narrated by Larry Wayne. Chapter 1, In Search of Competitive Advantage. Just as our amazing turnaround has not happened overnight, neither did our descent to such dismal satisfaction ratings occur quickly. A variety of factors contributed to our downturn, including poor management decisions, changes in the healthcare industry, and other distracting pursuits that ultimately proved more harmful than beneficial. These factors, combined with lack of vision, caused us to lose our focus as a healthcare organization. We had meandered into the last decade of the 20th century, maintaining our status, as I like to put it, as an outstanding, mediocre hospital system. We were doing okay, although our accomplishments were not especially noteworthy. With the unique challenges that the next few years brought, however, our status, even as mediocre, came into question. I often refer to the period of the early 1990s as merger mania. The bigger is better philosophy reigned in the business world, and the healthcare sector eagerly bought into that ideology. We at Baptist Healthcare became convinced, along with most in our industry, that we needed to form partnerships with other companies to create larger and stronger organizations if we were going to survive. We began seeking potential partners as we attempted to prepare ourselves for the future of healthcare. Our leadership team spent about 5 years in major merger discussions. We looked at 3 potential partners and held untold numbers of strategy meetings with board members and the senior management team. We met frequently with staff from the other organizations, calculating the potential savings of merging information systems and dreaming of increased negotiating strength and purchasing power. However, all 3 times, our grand plans fell through, and we found ourselves back at the drawing board. Although none of these talks led to a deal, merger mania affected us on the local level as well. While we had been busy pursuing various state and region-wide ventures, we had also been actively expanding our local presence by both acquisitions and innovation. By 1995, we had successfully added a large community mental health center to our organization, affiliated with 2 area rural hospitals, and started building a physician company. In 3 years, we had grown from 2,300 employees to over 5,000. Finally, in 1995, after 5 years of looking off into the distance, our leadership team began to turn its focus toward home. Baptist Healthcare was growing. However, we had taken our eye off the ball. The disconcerting survey data that we were receiving was telling us that we had lost sight of our mission. Employees were unhappy with senior management. Patient satisfaction was plummeting, and overall morale across the healthcare system was low. Clearly, we had become so obsessed with what was going on outside of the organization that we had forgotten to pay attention to the people on the inside. We had allowed Baptist Healthcare to stray from its roots, evolving into an organization that was not performing up to its potential and was not satisfying its employees, not to mention its customers. As this reality sank in, we began to see that in order to survive, we were going to have to make some dramatic changes. While we had not yet fully identified our problem, much less found the right solution, we were taking our first steps toward improvement. We had acknowledged that things had to change, and we were ready to do what it took to better our organization. Finding a competitive edge. Before we could begin moving toward the change we sought, we needed to assess our present condition. An evaluation of our current position in the market identified some major challenges. Our 2 local competitors were hospitals owned, respectively, by the Daughters of Charity, an organization whose $2 billion war chest led the Wall Street Journal to call them the Daughters of Currency, and the Hospital Corporation of America, an organization with immense equity capital. One of these local systems was at that time making a $300 million enhancement to their Pensacola campus, while the other was in the heyday of its equity accumulation. We were clearly at a financial disadvantage. We recognized that we could not compete by outspending our competitors.
Sample complete. Ready to continue?